So, hello, Dr. Nikhil. How are you?
Hello, Amitabh. I'm fine, thank you. How are you doing?
Yes, I'm good here in Guwahati by the grace of God. You know, the way the situation is going on, we have to say like this. We are here by the grace of God only.
I understand. I mean, the situation is very much difficult all over the world, actually.
Exactly. So, what about your Mumbai position right now?
Mumbai is in a red zone. There are a lot of cases which are here. Maharashtra is the leading state, actually. So many cases are there now.
Yes.
And in Mumbai, around my area also, a lot of cases have come up. So, we have to be really very careful.
Yes.
We have stopped working. We are not going to the dental clinic also. And we are in total lockdown.
Yes.
Better to be safe than sorry. And we would not like to spread infection anyway. So
day by day, it's increasing, you know.
Yes, that's right. Yeah. We have to be safe.
Yes.
We have to take care.
Yes,
we have
to stay at our home. You know, we have to take care.
Yeah, that's right. Yes.
No way out.
That is the best way. Yeah, that's right.
Yes. So, ladies and gentlemen, we have with us Dr. Nikhil Vasi from Mumbai. He is a dentist basically by profession, and he is practicing in Mumbai since last 34 years. It's a long years, you know. And apart from that, his this dentist profession, he is an entrepreneur, he is an investor, felicitator also, right, Dr. Nikhil?
Yes.
So you have vast knowledge. So
yes,
our audience would love to listen from you, your vast experience, your vast knowledge. So please share all these things.
So it's a pleasure for me to share my knowledge of all these years, and I specialize in putting braces for irregular teeth and jaws. So I'm an orthodontist and basically a dentist who is specialized in orthodontics. So I've been practicing for more than 34 years, and we provide total dental care to our patients in our clinic in Mumbai. So it is very important for us to maintain our teeth, because I'll be talking about it, how the teeth affect and the oral health affect the general health also. And just to start with the basics, like why teeth are important. Yes. We eat food and we need to chew that food, because if we don't chew that food, it doesn't get digested properly in the stomach and intestines and all. So first we are preparing the food so that it can get digested properly. So the teeth and gums and the jaws are a machine, which is helping us to chew the food properly, and the saliva mixes with the food so that it gets the digestion starts actually from the mouth only. So if some part of the machine is not working properly, the whole machine cannot function to the optimum, to the best ability, efficiency kind of. So that way the teeth also very, very important. And there are some misunderstandings in people's mind that I have so many teeth, like why should I take care of teeth? One or two are gone, then nothing happens. Or if something is going wrong, I'm not getting pain. So why should I go to a dentist kind of? So these misconceptions, and there is a fear about going to a dentist, because they think that there will be a lot of pain with the dental treatment. So these are the reasons that people avoid going to a dentist. But actually, we can take preventive measures, we can take corrective measures, and the earlier we take the measures, the better it is for us in the longer duration. Because if some damage is started, then we can stop it right in the beginning and then prevent further damage. And the treatment also would be much less initially if it is done. But if the damage is done more, then the more extensive treatment has to be done. So all these things, it's more of a preventive and then corrective measures. So teeth are very important. The gums are covering the teeth and the bone which is underlying, and the teeth are supported by the bone. So this is a whole complex which needs to be taken care of, right? And mouth is so very important for our whole personality. The smile is so important.
Yes,
so teeth are important for chewing also, for smiling also, and for speaking also, because some words are spoken with the help of the teeth, So if somebody is not having front teeth, then you speak not clear kind of. So it's very important that all the teeth are maintained properly for the whole life. They don't have to fall off by the old age kind of. That is one myth that people think that the teeth have to fall off when one becomes old kind of. That is not so. The teeth can be maintained for rest of the life.
Yes, absolutely. So, do you have any presentations so that people will easily understand?
I can.
So if you
I can show some pictures and I can talk about it in little more detail.
Okay, please.
Sure. I'm sharing my screen.
Yes, please proceed.
Why dental health is important? As I mentioned, the teeth are very important. And the function of teeth is like chewing and speech and smile is very important. And the gums cover the teeth and the supporting bone. And the most common dental diseases are swollen and infected gums, and the bone underneath, which is supporting the tooth, gradually becomes less and less. So that support for the tooth becomes less. So that is one thing. And there are holes developing in the cavity in the tooth. It is called cavities, and it is because of dental decay. The tooth is getting eaten up by the bacteria which are there in the mouth. There is one sticky substance which forms in the mouth every few hours. So that is the reason we brush our teeth. We brush our teeth to remove the plaque. So whatever the bacteria there in the plaque are removed. Otherwise, what happens? The bacteria remain in the plaque remains stuck onto the tooth, and the tooth gets eaten up because of the bacteria and the food we eat. The carbohydrates especially, that is the sweets, chocolates, bread, biscuit, cakes, cookies, etc. These remain stuck onto the tooth, the bacteria already there, and they produce acid when they eat the carbohydrates, that is their food. So that acid which is created eats up the tooth, it destroys the tooth structure, and that is irreversible, right? So cavities is one common problem, and infected and swollen gums is another problem. That also is happening because of the plaque which turns into tartar deposits. The plaque stays soft for 2-3 days. After that, there are salts from the saliva which gets deposited in the plaque, and it becomes hard and it turns into tartar. So the tartar cannot be removed with the brush. So before the tartar forms, we need to brush our teeth and remove the plaque. Once the tartar forms, it gradually goes on building up unless you go to a dentist and clean it out. Otherwise, I will be showing some pictures where you can see how the plaque, the tartar builds up and it starts destroying the bone underneath. Right, so these are the two most common problems here, the cavities and the gum problems. But that is not all. Like people who have a habit of taking tobacco, putting it in the mouth and keeping it for a long time, they are very high risk people to develop oral cancer. There are so many people in our country who develop oral cancer because of habit of having tobacco. And smoking also is not good for the mouth also, not only for the lungs. Right, so this is a very important factor which one has to keep in mind. And not only that, the plaque which is there in the mouth affects our whole body. It's a very dangerous substance, and it is connected with many physical conditions like heart disease, dementia, stroke, diabetes control, premature births, pneumonia, pancreatic cancer, rheumatoid arthritis. So there's a whole list of conditions where the dental plaque causes damage to the whole body. So it is such a simple thing, just brush your teeth and remove the plaque, and all these consequences can be avoided, right? So that's why it's very important to take care of the teeth by brushing regularly, and these damages are irreversible. So just by simple spending few minutes in the morning, few minutes in the night, and maybe in the afternoon after food, so much damage can be prevented actually.
Okay.
So the gum problems are swelling in the gums, there could be bleeding from the gums, and there can be infections in the gums, which all leads to the bone loss. The supporting bone becomes less and less, and the tooth starts shaking, and then it will eventually fall off. So this is just a picture showing the tartar deposits which has developed over a period of time. And you see the gums which are so red, swollen, all rounded up kind of. And here the tartar deposits are less, but still there is this deposit is there, this redness is there. And this is after cleaning, you see so much change is there. All this swelling is reduced and all these teeth are looking clean now. But the only difference here is that because the tartar was covering the teeth and the gums have receded, the roots of the teeth have got exposed. Now, there would be a chances of the teeth being sensitive to hot and cold. There is treatment for that also, but again, if the person had gone for treatment earlier, this damage would not have happened. So it is very important to go to a dentist and get the cleaning done if the deposits have already developed. This is the same patients, the other side, right side picture, before cleaning, after cleaning. You can see the gums are so much flat and pinkish. Here they are swollen and red. I hope you can see it very clearly here.
Yes, it's very much clear.
Yeah, and this is the X-ray of the same patient. You see, this is the jaw bone. The teeth are in the bone here, and so much of bone loss has happened because of the tartar deposits. And you see here, there is hardly any bone. So this tooth would be shaking. It is just about to fall off, kind of, right? And Here, this area, dark area, shows some infection in the tooth there. And this is an old filling which is showing some cavity underneath.
Yes.
And since these teeth have been lost much earlier, the opposing teeth have extruded, they've come down. You see, this level of the tooth should have been somewhere here, but it has come down because there is no opposing tooth. So that belief that even if one tooth is lost, I am able to chew. But what is happening is slowly the opposing teeth move. And here you see, these teeth have shifted forward. They're slanting now. So all these damages happen kind of.
Okay.
So that's why it's very important to the machine, the jaw, the food chewing machine has to be taken care of. Like we maintain our vehicles and go for servicing very regularly. This is our body, and it needs regular servicing kind of by going to a dentist and keeping it clean every day. So the same patients inside behind the teeth, there is so much of tartar deposits, and this is after the cleaning up. This is the front view of another patient. Here the damage is much less. And once the cleaning is done, the gums go back to its normal position. So recession doesn't happen in every condition if it is detected much earlier. Here there was not much, so the gums have become normal here without resetting kind of, right?
Okay.
Is a close-up of that. Another thing is the cavities. Can you see this black area here in the front of the tooth? See, this tooth is looking very clear, normal. But here you see there is a hole here.
Yes.
And this tooth is black. So that is because the tooth has got decayed from inside. There is a dental caries, which is the name of the disease. Caries is the name of the disease. It is spreading inside the tooth. And it is destroying the tooth. So what we do is, dentists is, we clean up the tooth and remove all the infected portion and fill it up. Right. Another thing to notice here is the gums. The gums are so red and swollen here. See, it is very noticeable here. The gums are so red and swollen. And this is after this filling was done here in this tooth, and these two teeth also here. This is after filling. You can't make out that there is a filling done. So that is the beauty of the today's material what we have. We can match the tooth so well that you can't even make out. And this tooth is saved. That further damage is obstructed, stopped kind of. It doesn't damage further. And the person takes care of this tooth is going to remain in the mouth for many, many years. And the cleaning was also done. So you see how the gums have settled down. They become pink and flat and not swollen like this. This much, everybody can look in the mirror and see one's own teeth and see whether the gums are swollen, whether deposits are there, some cavities are there in the front. It's very simple to take care of one's own teeth, right? Every day morning we get up and brush our teeth. We can look in the mirror and see everything is all right. And only thing is whatever is happening inside on the inner teeth, that is difficult to make out from outside, because if you're seeing the front teeth, you can see. But deep down inside, suppose cavity is developing, you won't be able to make out. So that's why you go to a dentist to get a checkup done. So if and there is no pain initially. In this condition, there is no pain. So person feels that since there is no pain, everything is all right. Even when the gums are swollen, there is no pain. So person feels it's okay. So that is these are the two conditions in the mouth where pain is not an indicator that the disease is progressing. When the pain comes, a lot of damage is already done. And this is after doing the fillings. You can see you can't even make out the fillings have been done. So these teeth are now restored completely to function and form, and the shape, size, color, everything is matching. Isn't it? So this is like new teeth almost.
Right. Absolutely.
This is another condition where the filling was there, old filling was there, but there is decay which has taken place around the filling. This is another filling, but decay is around the filling. So if you think that I've already got one filling done once, so I don't need to go to a dentist, it is not so. The cavity may be developing around that filling or in other area of the tooth. So it is regular checkup is very important. And once we remove this filling, we could see that there is so much of decay underneath. See, all these brown areas are decay which has gone in, and then we clean it up fully and then do the filling like this. So this tooth is now restored like new one. Right, and this tobacco chewing habit not only causes cancer, and locally it is causing a lot of stains and all. So this cleaning up also takes a long time because the stains are very, very hard to remove. But more dangerous thing is the cancer. So one has to really be very, very careful about this, not taking tobacco in any form.
Yes. So how often
And
one people should visit to any dentist? Is it year once in a year or half yearly?
beyond 6 months, it's very, very important that you go to your dentist and get your teeth checked and see that everything is fine. And if something is going wrong, get it corrected.
Okay. It's fine.
Right? Otherwise, what happens? I'll show you. This person had a cavity which developed so much it went right inside into the tooth. This is the pulp area where the nerves and blood vessels are there, and you can see this is the tooth destroyed so much that cavity has progressed right inside. And here under this filling also it has progressed, and there is a big infection here. Can you see this dark
Yes,
area
yes, I
here?
can see it.
That is the infection which has gone from this cavity into the tooth. So now what we have done is we have done a root canal filling here.
Mm-hmm.
So we opened up the tooth and cleaned up from inside. Even if the canal is curved like that, we can still fill it up like nicely. And then once the filling is done, it is like this.
Okay.
And after 6 months, when you take this X-ray, this will all be uniform like this. It will be healed completely. And this is the neighboring tooth which was also filled up. So this is what is root canal filling. So it is not painful. People are really worried. Oh, I have to go to a dentist and my tooth is paining, and root canal filling will be very, very painful. It is not so. If you go well in time, then it is absolutely painless. Most of the dental procedures are painless because we can give local anesthetic and we can do it under anesthesia effect, so person doesn't get pain. And since I'm an orthodontist, if you want me, I can show you a little some pictures of how we correct the teeth.
Yes, yes. Please proceed.
Of the patients and what difference does it make?
Yes.
Then maybe we can have some questions. So see, this person came with such irregular teeth like this, and
Yes.
then after putting the braces, we straightened them.
Mm-hmm. Okay.
So we had to remove one tooth from either side because the space in the jaw was less.
Okay.
So what we did was we removed one tooth and the neighboring teeth shifted in there. So there is a misconception that if you remove a tooth and it spoils the eyes and all. It is not so, because there is no direct connection with the tooth with the eyes, kind of, right? So in 7 cases out of 10, we have to remove teeth, and nothing happens to the patient. In fact, it improves only. Now see that these teeth are meeting so well, so they are more efficient in chewing. The person looks so better, and the person feels so confident about herself.
Yes.
I'll show you the picture of the face. See how the smile was earlier and afterwards. There's a tremendous difference, and the person feels so good about herself, for himself, whoever is getting it done, right? So that is one thing. And here in this case, this person had very protruding teeth. Like the smile was quite gummy, and the lips were not closing. The teeth were jetting out. And again, we extracted teeth, took the front teeth in, and this is how she looked, looking so different and so good. Right? So there is one more case, similar one. The person could not close the lips. The smile was very toothy, but afterwards it became so uniform and very attractive.
Yes.
And,
So, Dr.
is
is there any minimum time to brush? Like say 2 minutes, whatever.
Once you brush, you have to see that each and every corner of the mouth is clean, all the teeth are clean from outside, inside, and behind also. So in the lower also from behind, upper also from behind. So if you do it with the proper technique, then everything will get clean. Okay. And you can also use a dental floss. There is a thread available in medical stores. You can get that thread. You have to take some 3-4 inches and tie it on your finger, and then put it between the teeth. So the brush doesn't reach in between the teeth. So this floss will help in removing from the plaque from in between the teeth. So it is very important to do flossing also. Wow. So with the floss, the plaque is removed. Right. This is one last case I'll just show you, and then we can proceed. Yes. This is a growing child, and the teeth were very irregular. So we put the braces. This was with the braces, the teeth were aligning, and this is at the time of after we removed the braces, the teeth were so lined up, right? So it is very important to brush after every meals to prevent permanent damage to the teeth and supporting structures, right? And what care people can do is to brush every day, at least twice or more. If you eat sweets, bread, chocolate, etc., then brush immediately, because we don't want that to remain stuck onto the teeth for hours together, because the damage starts very early. Within a few minutes, the damage may start. So earlier we remove, the better it is, right? And floss your teeth every day, and get a dental checkup done every 6 months or earlier, as I explained, right? So this presentation I can stop here, and we can have a talk.
Yes, yes. No, it's a
I
very,
hope it will
very,
be
very,
useful
very
to the
informative,
people who are.
very, very informative discussion. Thank you so much, Dr. Nikhil, for sharing your vast experience and knowledge. It will definitely help all the people. This is much
Thank you so
needed.
much, Amitabh.
It's our daily work. We normally it's a very important work, but we
Yes,
used to ignore these things. So
that's right. We just take it as a routine, kind of.
yes, yes,
We
yes.
don't understand why we are doing it, actually.
Exactly, exactly. Your nice presentation
Yeah,
will
we just do
definitely
it.
help the
Yeah,
people to do the needful.
that's right. Yeah. I hope it encourages and motivates people. So that's
Yes,
what we
yes,
want, that people should be happy, healthy, and live longer, right?
right,
So
right.
brushing the teeth can make you live longer because it will help you in preventing general conditions also.
Absolutely.
And you'll see so much of pain later on and expenses also.
Exactly, exactly. So once again, Dr. Nikhil, thank you so much for sharing your experience and spending your valuable time, giving us your valuable time for all the people.
Thank you, Amitabh. It was a pleasure talking to you, and thank you for giving me this opportunity to talk to you and to your listeners and viewers.
Thank
Thank
you.
you so much.
Thank you. Thank you. Bye bye.
Bye.